Mm. Okay. All right, people are still joining, so we'll just wait another minute or two. Okay. Oh, I was about to say it looks like things are slowing down, but then someone joined. But I think we're ready to get going. So thank you everyone for joining us today. My name is Patricia McDaniel, and I'm here with my colleagues Libby Smith and Ruth Malone. Together, we are UpEnd Tobacco, the UCSF project for Endgame planning. We're a statewide organization, an Endgame project funded by the California Tobacco Control Program, and we are one of several other Endgame-oriented programs that offer training and technical assistance to California state tobacco control grantees. We're going to be talking today about a publication that we recently released on Rover. It is called The Evidence for the Endgame, a white paper, and it summarizes some of the endgame-oriented policies that local communities in California are pursuing and the evidence that supports their effectiveness or potential effectiveness. Keep in mind that this is a work in progress. New research is coming out all the time and new policies as well. So we expect to be continually updating this paper. So here's an outline of where we're headed today. We're going to start with a background on California's shift towards an endgame approach. Then we'll discuss a variety of endgame-oriented policies. We'll highlight what each is intended to achieve in general. We'll give examples of localities in California that have adopted these policies. We'll give at least one example of research showing the potential or actual impact of the policy, sometimes on youth, sometimes on adults, in reference to smoking prevalence or on some tobacco-related measure. The citations for this research evidence that we talk about will be found in the white paper itself. So if you have questions about that, you can look in the white paper. Then I'll hand it over to my colleague Libby, who will discuss some of the bigger issues impacting the success or not of these policies in California. And that includes the issue of tobacco sales in sovereign tribes and public opinion about these policies. We'll end with questions, so feel free to submit those in the Q&A box. So let's get started. The California Tobacco Control Program has embraced the idea of moving from tobacco control to a tobacco endgame. And by tobacco endgame, we mean initiatives designed to change or eliminate permanently the structural, political, and social dynamics that sustain the commercial tobacco epidemic in order to end it within a specific time. California has a goal of ending the commercial tobacco epidemic for all population groups by 2035. This goal does not include eliminating or limiting traditional tobacco use, such as tobacco plants grown or harvested and used by American Indians and Alaskan Natives for ceremonial or medicinal uses. And getting there will build on the work that local communities have been doing for the last 30 years. Many of the communities at the vanguard of endgame-oriented policies are focusing on smoke-free places and retailer-based interventions. In establishing smoke-free places, the goal is to denormalize smoking, reduce tobacco use, and reduce or minimize exposure to secondhand tobacco smoke. One approach is to establish smoke-free outdoor places, for example, beaches and parks. A number of California localities have adopted smoke-free beaches and parks, and this is just a few examples of some of those places. And in terms of evidence of the impact, a few studies, including this one from Canada, have shown that after smoke-free beach and park ordinances are introduced, observed smoking declines. And in this particular study, the observed reduction was greater at parks than at beaches. Another approach is to establish smoke-free multi-unit housing. This slide lists just some examples of the cities in California that have adopted ordinances prohibiting smoking in and around multi-unit housing. Studies looking at the impact of these policies have relied on self-reports of smoking behavior, as well as environmental monitoring of secondhand smoke exposure. And several studies found that residents living in affordable multi-unit housing report smoking less and quitting smoking at higher rates after their buildings went smoke-free. 3 studies using monitoring of smoke-free, using environmental monitoring in these multi-unit housing have found declines in secondhand smoke levels in common areas. Some things to keep in mind about smoke-free multi-unit housing policies: they are dependent on engagement from property managers and tenants for enforcement. They may also disproportionately impact low-income people, including people of color and LGBTQ people, and should thus be paired with cessation services. There's also a concern that smoke-free multi-unit housing policies may increase the risk of housing insecurity and homelessness, although emerging evidence suggests that this hasn't been the case so far. The next category of endgame-oriented policies that we'll be discussing is retailer-based interventions. These focus on altering the affordability or availability of tobacco products at the point of sale by raising prices, limiting the number or type of legal sellers, or restricting the types of products that may be sold. And a first step is a local tobacco retail licensing system with a fee large enough to fund administration and enforcement activities. The state of California requires tobacco retailers to obtain a license and pay an annual fee. A licensing system at the local level, on top of that, enables jurisdictions to enforce existing laws. So that's one nice benefit. And forms the basis for establishing and enforcing future policies. A TRL can also reduce retailer density by creating barriers to entry for retailers. Some retailers may not want to go through the hassle of filling out paperwork and paying a fee to get a license. And TRLs can also reduce youth smoking prevalence as a result of having a reduced retailer density. So more than 241 local jurisdictions have adopted a TRL, and these are just examples of some that have done so in California. And in terms of evidence showing their effectiveness, there are several studies in California that have shown that retail sales to minors decline after strong TRLs are introduced. So in Southern California, for example, high school students living in places with strong TRLs were less likely than those living in places with no or weaker TRLs to have ever smoked or to have smoked in the past 30 days. They were also less likely to report e-cigarette initiation. Some things to keep in mind about TRLs. Education about licensing requirements can be a communication path with retailers, possibly reducing opposition to other retailer-based interventions. TRLs also enable control over sales of future new tobacco or nicotine products, but they may be difficult to enforce without adequate funding and buy-in from enforcement agencies. Another retailer-based intervention is a minimum price law. And by establishing a minimum floor price below which tobacco products cannot be sold, the idea is to raise tobacco products. So for example, the cigarillos that are quite inexpensive that you see on the screen on the left would be sold for a much higher price, and thereby hopefully you would reduce tobacco use. Here are just some of the jurisdictions that have adopted minimum floor price laws. And they have so far typically set that price somewhere between $7 and $10 per pack of cigarettes, and $5 to $8 for single cigars and packs of little cigars. Because these policies are relatively new, the evidence for their effectiveness comes from modeling studies. These studies all predict declines in smoking prevalence and cigarette consumption, particularly among smokers living in low-income households. And the figure on the left comes from a modeling study looking at what would happen with the minimum floor price law in Oakland, and the researchers set the price from $8 to $13 per pack, and you can see that the smoking prevalence declined under all of those price points, but just at different, by different amounts. So minimum floor price laws are most effective when combined with a ban on manufacturer coupons or other discounts and a minimum pack size. Both of these help keep the prices high. They also work best when they complement rather than replace high tobacco taxes. Because these minimum floor prices generate revenue for retailers and manufacturers, they may also face less industry opposition, but they may be hard for elected officials in jurisdictions with high poverty rates to embrace, so creative messaging may be required. Another retailer-based intervention involves limiting the number or types of retailers. These policies reduce youth access to tobacco products, reduce exposure to tobacco advertising, and reduce tobacco retailer density. They also increase tobacco search and purchase cost, which creates a barrier to tobacco consumption because it's more difficult for people to find tobacco products. And they denormalize the tobacco industry. Tobacco is no longer sold on every street corner at practically every type of retailer. One way to limit the type of retailer is to prohibit the sale of tobacco in pharmacies. This has been done in the jurisdictions listed here and in many others in California. Research looking at the impact has focused mostly on the impact on retailer density, finding declines, but mostly in higher income neighborhoods. And one study did look at cigarette pack purchases after CVS stopped selling tobacco. It found declines in those purchases and increases in quit attempts in counties with high CVS density. Another option is to ban tobacco sales in certain, in other types of outlets like convenience stores or grocery stores. This hasn't been done anywhere in California yet, although some grocery stores have voluntarily ended tobacco sales. Studies modeling the potential impact show greater reductions in tobacco retailer density with bans on tobacco sales at convenience stores than with bans on sales at pharmacies, although again, the greatest impact is on higher income communities. Another way to limit the number of tobacco retailers is to create retailer-free buffer zones around schools or other youth-oriented places. This has been done in these California jurisdictions as well as some others. These are just some examples. And in terms of the evidence for their effectiveness, a study of what happened after Philadelphia created a 500-foot buffer zone around schools found that the buffer zone reduced the average number of retailers near schools by 22% after 3 years, even with existing retailers grandfathered in. Another approach is to require a minimum distance between retailers as a way of limiting the number of retailers out there. Here are some examples of jurisdictions in California that have adopted this policy. And research looking at the impact of this policy has only looked at the potential impact, finding that a minimum distance policy of 500 feet would, for example, reduce tobacco retailer density in North Carolina by 22%, and in Texas would reduce total tobacco advertising near schools by 18%. You can also limit the number of tobacco retailers by restricting some or all tobacco sales to adult-only stores or tobacco-only stores. 6 California cities have adopted this approach, although only for flavored tobacco products. And evidence from the East Coast shows that these restrictions reduce the likelihood of teens trying a flavored tobacco product or ever using any tobacco product, and reduce current use of e-cigarettes. Jurisdictions are also starting to experiment with limiting the number of licenses issued based on geographic area or population. San Francisco was an early adopter, putting a cap on the number of licenses issued per supervisorial district. Other cities like Huntington Park and Linwood limit the number of licenses to 1 per 1,000 residents. So they take an approach similar to how many cities approach just giving out liquor licenses. In San Francisco, 10 months after the cap was introduced, the number of tobacco licenses fell by 8%, with greater declines in districts that originally had more retailers. In Philadelphia, 3 years after implementing multiple retailer license restrictions, including a cap of 1 retailer per 1,000 daytime residents and a 500-foot buffer zone around schools, the number of tobacco retailers declined by 20%, with low-income neighborhoods benefiting slightly more. Some things to keep in mind about limitations on the number or type of retailer. Retailers will most likely object to many of these proposals. However, as tobacco sales decline in California, retailers will need to transition to a new business model that doesn't rely on tobacco sales. Another consideration is that because some of these policies have been adopted in some California jurisdiction, that suggests that they are politically feasible, at least in some places. With some of these approaches, however, like tobacco-free pharmacies, low-income neighborhoods and neighborhoods with high concentrations of African Americans and Hispanics will benefit the least, because pharmacies make up a smaller proportion of tobacco retailers in those neighborhoods. To have a real impact on tobacco use disparities, more than one retailer reduction policy may be required. Rather than limit the number or type of retailer, another approach is to prohibit the sale of particular types of tobacco products. And the goal of these types of policies is to reduce tobacco initiation, increase successful quit attempts, and reduce tobacco use disparities. Flavored tobacco bans are one option gaining momentum in California. And when I checked last week, 72 cities and counties had taken this approach, banning the sale of all flavors of tobacco products, including menthol flavor. And another 40 have adopted some sort of restriction on the sale of flavored products. The evidence regarding the impact, and these are examples of some of those places that have adopted flavor bans. And the evidence regarding the impact is still being gathered. One early study looking at a Canadian province that adopted a menthol cigarette ban in 2017 found that daily and occasional menthol smokers had higher rates of self-reported quitting than non-menthol smokers. And in the US, several studies have predicted that anywhere from 35 to 66% of menthol smokers would quit if faced with a menthol ban. And those studies are based on just asking smokers how they would respond. A more comprehensive approach is to prohibit the sale of all tobacco products, not just flavored products. This has been done recently in Beverly Hills and Manhattan Beach and is being considered in several other jurisdictions. Since these policies are so new, we don't have evidence yet regarding their impact, but we do have evidence that suggests that removing cigarettes from the market would result in fewer people smoking because higher tobacco outlet density is associated with a higher likelihood of smoking initiation, and living near tobacco outlets is associated with unsuccessful quit attempts. Point of sale promotions, which are the most visible tobacco advertisements, would also be eliminated. And removal of these displays is associated with reduced odds of regular smoking among adults and adolescents. And ending tobacco sales would also further denormalize the tobacco industry. So some things to keep in mind about both of these approaches is that flavor bans currently have political momentum in California, in part because of the message that flavored products target children. And they may set the stage for phasing out all tobacco sales. We've heard that when flavor bans are discussed, policymakers in several different cities have remarked that it would make more sense just to ban all sales. So that's just something to keep in mind. And finally, increasing the availability of cessation programs and tools is likely to be important when considering sales bans. So now I'm going to turn the presentation over to Libby Smith, who will talk about some of the bigger issues impacting the success of these policies in California. And I have lost my ability. Oh, there I have it. So let me stop sharing. Okay.
Hi, everyone. So I'm going to talk about a couple of these larger issues, including first, tobacco sales and sovereign tribes. Let's see if I can advance my slides. There we go. So this is really going to be key to the endgame for a couple of reasons. First, I want to stress, of course, that all of the policies that we're discussing are focused on commercial tobacco products and not on tobacco for ritual or medicinal use by sovereign tribes. But in addition to that ritual use, of course, there's an issue because many of the tribes in California have tax-free tobacco sales upon their lands. And although those sales are technically supposed to only be for the tribes themselves, other people do go and purchase their cigarettes from these tribes, and there really isn't any enforcement mechanism on that. So this, of course, has the potential to really undermine any sales restrictions that a locality might put in place if one of these tobacco selling tribes is in their vicinity. So it's going to be important to address that issue. In addition, though, tribes also have high commercial tobacco use rates. This issue is a result of a history of genocidal practices and tobacco industry targeting. And this might actually be a point of for tobacco control advocates to make common cause with the tribes if there's some focus on helping tribes resolve that problem. That may be a point of entry for negotiation about tax-free sales. In addition, there is the possibility of establishing cooperative agreements or compacts with the tribes. Either the state could do this, or potentially localities could do this to negotiate something agreeable with the tribe that would help to get the tribes to support tobacco control policies nearby, or end commercial tobacco sales altogether. In terms of public opinion, the state has been surveying about issues related to endgame policies for the last several years, and the results are quite promising. So, for instance, in 2019, the state found that adults in California supported smoke-free beaches and smoke-free parks. About 70% supported those, and more than 50% supported smoke-free rental units. So that suggests that there is, there is going to be support for those policies in many jurisdictions in California. Adults also support prohibitions on the sale of menthol products, candy-flavored cigars. They support an end to coupons and deep discounts, and they also support tobacco-free pharmacies. All of those, over 50% of adults support these policies, again, suggesting that there's a real possibility for localities to pass these. There's even support for ending cigarette sales, which is a little bit surprising, just considering that there's really never been a campaign or an effort, to try to pass a policy like this, except in the very small jurisdictions of Beverly Hills and Manhattan Beach. But in 2019, the state of California found that almost 40% of adults supported an immediate end to cigarette sales, and more than 50% supported a gradual end to cigarette sales. High schoolers in 2018 were even more enthusiastic about these policies, with more than 50% supporting an immediate end and more than 70% supporting a gradual end to cigarette sales. And of course, those high schoolers are going to be the voters currently and in the near future. So that suggests that there's, there's a real movement toward acceptance of these ideas in California. So that is the end of this part of this webinar. We just want to say that for those of you who are working on tobacco control in California, UpEnd Tobacco is a statewide project. We're here to help you with your endgame-oriented policy projects, including developing argumentation, giving workshops, and also individual consultations. So you should feel free to get in touch with us through partners or through our emails. And the white paper on which this webinar was based is available on Rover, which is available to California tobacco control advocates. And I will put the link in the chat box momentarily. I believe it will also be available through the ASH website, and perhaps we can have a little more information on that. And now we are open for questions, and I believe Ruth will be handling the questions from the Q&A.
Yeah, thank you, Libby and Patricia. And we've had a few questions back and forth in the chat as well. One question that was asked was, is there a universal, this was by an anonymous attendee, asking if there is a universal strong versus weak tobacco retail license definition. I don't think there's a universal anything, but do you have comments on this idea of strong versus weak TRL?
I would say that a strong TRL is generally one that has a fee large enough to cover enforcement activities and one that includes enforcement activities.
And I believe that the California Tobacco Control Program is also looking for combinations of TRLs with activities to reduce retail density or numbers as well. Could you share the slide with the definition of endgame again, or post to the chat?
Okay, I will just go ahead and post it. Just 1 second. So you can carry on.
Yeah, and we are also happy to share some of our papers that we've published on endgame that talk about the definition of endgame. But just to review, endgame policies are those that address the structural, political, and social dynamics that keep the epidemic going. So an example of a structural dynamic is having lots of retailers in areas with populations of color, for example. That's a structural dynamic that perpetuates the epidemic. Political dynamics, I think we all know, are the industry and its allies and front groups and so forth. And then the social dynamics really have to do with the way we think about tobacco as a normal consumer product. So that's where I think, we have a lot of work to do in tobacco control across the country as we move toward this end game discussion in terms of saying, wait a minute, this isn't a normal consumer product. This product kills people. So back to the questions. The evidence for a total ban, is this similar for a ban on the sale of e-cigarettes? Any differences known? We have seen many Bay Area communities having these policies. I'm assuming the policies related to the ban on the sale of e-cigarettes. So differences between the evidence on these.
Well, I'd say that people haven't really gathered direct evidence about either policy of banning tobacco sales or e-cigarettes because they're both pretty new. But I would assume that the evidence that I discussed that sort of forms the rationale for why these bans might be successful is the same regardless of the product. And some of the rationale that I talked about was the idea of reducing tobacco retailer density has been found to be associated with reduced smoking initiation. And then the idea that you would have reduced exposure to both tobacco products and e-cigarette products would thus result in fewer adolescents initiating smoking, because we have a lot of evidence showing that advertising, marketing has a strong influence on smoking initiation among youth. And I assume it also does for e-cigarette initiation. I think that evidence base is starting to be gathered.
A question from Frank Sitters. Are there provisions in the Manhattan Beach or Beverly Hills policies about growing tobacco for personal use? I can answer that, I think. I don't recall that there are any provisions about this because the ordinances pertain only to sales of commercial tobacco products, retail sales. There are no provisions for purchase, use, or possession sanctions. So the idea is not that you're going to be arrested if you have a tobacco plant growing in your backyard. The idea is to address the structural, availability of these as a normal consumer product. And so I think that should answer that question. No, there are not provisions about growing tobacco for personal use. Another question, how long, I think it's supposed to be how long ago, this is from Sam Stevens, how long ago was the survey from Libby's presentation conducted? wanting to know more information about how many participants, where it was conducted, was this information shared with local governments? And I believe that those data are available on the California Tobacco Control Program website, if I'm not mistaken. But Libby, do you know the answer to those questions?
Not off the top of my head.
I actually believe that there are some more current data that are still being analyzed and probably will be published before too long about public opinion on some of these policies. But I don't have the details on the numbers. It was I know it was a representative sample. And then I think more recently they've done some comparisons with these were more recent studies were conducted by RTI International and were compared with data from other states as well. A question from Carol Matum: where can we get more information on public support for ending sales as mentioned in the presentation? So yeah, I think we're waiting for those data to be published. And I think, interestingly, this is an area for a lot of interest in research. I just got a paper at Tobacco Control, the journal, looking at this question in Australia. So I think a lot of places are very interested in the baseline of public support for ending cigarette sales. An anonymous attendee asking, is there a proposed source of funding for local enforcement of an endgame law? Are we going to leave tobacco sales enforcement to citizen complaints? I don't know if either one of you want to take that, but I could respond if
Go ahead.
not. I believe that in Beverly Hills and Manhattan Beach, enforcement is delegated to people in the public health department. They already had some programs around tobacco ambassadors, for example, that educate people about their smoke-free outdoor laws. But this may vary from jurisdiction to jurisdiction. Many of these laws, like smoke-free laws, are delegated to are self-enforcing in that it's a complaint-driven issue. But I think for most retail policies, you probably will not find a lot of violations, but that remains to be seen. Another question: beyond some public opinion polls referenced today, are there any regional feasibility studies that demonstrate there is adequate political will for all regions in California to achieve the Endgame 2035 goal? I'm not aware of any regional studies, and I don't know that there is, that there is a regional approach. Although I think it's a great idea. Do you guys have any comments or information about that?
No, I don't know of any regional studies. I know that, individual jurisdictions will sometimes gather research or, public opinion research themselves, but I don't know of any regional data.
Some of this, I think everyone recognizes that the political will for some of these policies is much stronger in some areas than in others, and that it's not all going to happen at once across the state in any way. So I think the whole endgame vision is a bit more about moving our mindset so that we really are envisioning and all of our work as heading in this direction. And some places will be getting there more quickly than others. But this is why I say that I think the social dynamics are maybe where we need to work the hardest, in places where there is little political will. And I see Tom Novotny is responding with a comment saying that there is some evidence that truth has produced about this, about public opinion. A good question. What are some approaches to reduce unequitable enforcement of public smoking laws, such as a smoke-free park or downtown? I've heard concerns of these types of laws being used as public nuisance laws as a way of asking houseless individuals to leave an area, but where the same law might not be applied to higher status individuals. Really good concern. Comments on that?
Well, I mean, I think some of it's going to be, who's tasked with enforcement. And, clearly adequate training has to be given to whatever department is tasked with enforcement. But the other thing is, I think that it can be a social norm shift, having a policy like that, even if it does not end up being strictly enforced. And of course, by that, I mean, I don't mean like, let the higher status people smoke and not the others, but simply, try to gradually, make the norm so that there is not smoking in those areas. I don't know that there's anything else about.
Well, I think one of the things that CTCP is trying to do is also to fund leadership from within the communities with higher smoking rates, people of color and LGBTQ populations that still have much higher smoking populations, and to really get them to take a lead on energizing and organizing communities around policy change in this area and help them understand the way they've been targeted by the industry, which is something that we've done a lot of work on. And that transforms what the tobacco issue is for communities from being an individual behavior thing that we don't want you to do, more towards we don't want to be targeted by this industry with these deadly products. And once you sort of make that shift, it changes the whole conversation. I don't think anybody believes that any tobacco control policy is going to be 100% effective. I mean, no policy is. There are still people who drive around and don't wear seatbelts. So the point is, you have policies because they do change social norms, and most people observe the policies. And I think always the question is doing something going to make things worse than the status quo, where the single most deadly product in history is still for sale everywhere, for example? So yeah. Another question, can you address endgame strategies in the context of decriminalizing cannabis? Very interesting question that I think, and this has been discussed in some other states, and that maybe have a harder time anticipating the sort of end game that we may be able to do in California because, for example, they have preemption, but they may have pretty strong cannabis regulation. Even though it's decriminalized, it may be, the number of outlets may be limited, where it can be sold may be limited. There are a much smaller number of outlets for retail sales. The outlets are restricted to adults only, that sort of thing. So even if we simply harmonized tobacco retail regulations with cannabis regulations, I think in most places that have done this, we would be doing better than we are now. Livy or Patricia, did you want to add anything to that?
No, I think that was a great answer.
I just want to add that I've put a couple of times in the chat now a link to our evaluation, and we would really appreciate it if people would fill that out before they leave.
How about online sales restrictions and higher taxes? That's a very good question also, and that's another area that we didn't really get to talking about, but that we've had a lot of discussion about. Online sales, like tribal sales, are another place where I think there's a lot of thinking that is going to have to be done, because we don't have really great ways to regulate those, I think, at this point in time. And they, particularly since they kind of keep, websites come and go. And so that is an ongoing area for work, but there are some policy changes that can be made to help facilitate that. I don't really have time to get into detail on that, but some of our colleagues have done some studies on this, and we'd be happy to share those. If somebody wants to email us, we can put you in touch with some of the people that have looked at that. In terms of higher taxes for online sales, if that was the question, I think that clearly that would have to be done at the state level. That's not something that could be done at the local level, which is really mostly the focus here of this presentation.
So I'm looking at the chat. There was a question about updated San Francisco data regarding the cap on licenses. And we do have an answer from the person in charge of that, who says that in San Francisco, we experienced a 34.5% reduction from June 2014 to June 2021 of tobacco retailers in San Francisco. And we have another question too about a resource tool or doc that is tracking the number and types of tobacco policies throughout the land of California that have passed. There is the PETS database, which is available through Rover to all of you California people through Rover and through partners.
Another question from an anonymous attendee: does your Endgame, and again, I think when we refer to Endgame, there is no one Endgame. There is an Endgame. The Endgame goal is to basically eliminate the influence of the tobacco industry on the health and welfare of California's diverse populations, and ideally achieve less than 5% tobacco use prevalence by 2035. Does it include vaping and nicotine products or solely commercial tobacco? I would see many vaping and nicotine products as likewise being commercial, but in the distinction that was being made about commercial versus tribal is a different thing. California is pursuing an endgame strategy that includes all tobacco products. And I know some places feel that there should be a strategy of moving people to products that are thought to be less harmful and focusing on reducing the use or sale of the products that are the most harmful, like cigarettes and combustible products. That is not at this point the strategy that California has taken, largely because of the youth vaping epidemic. Any ordinances, policies that address free loose leaf roll your own tobacco in terms of taxes, et cetera. Some people buy the bags and roll their own. I think those are included in statewide tobacco taxes. Again, tobacco taxes aren't set at the local level, but to the degree that minimum prices are set at local levels as part of an end game strategy, then they should certainly include loose leaf tobacco because there's no indication that it is less harmful. Question about talking a bit more about how marginalized groups have been engaged in deciding what policies should be in the end game. Those are groups that have been funded by the California Tobacco Control Program and other groups even before that, who have been arguing, for example, in the case of the African American Tobacco Control or Tobacco Coalition, I'm forgetting its formal name, and others who have long been arguing for a ban on menthol products and have been behind and engaged in the discussions in Beverly Hills and Manhattan Beach about sales ban policies. The California program also funds several priority populations coalition or groups that work with these populations to reduce, to engage them on working on tobacco control policy. And they're part of the coalitions that are required under California's tobacco control program. During a webinar with other tobacco-funded agencies, there was a comment from a participant around what resources besides tobacco cessation will be offered to tobacco users after the end game. For example, will there be enough mental health resources if people are using tobacco products due to stress? Does somebody want to take that one? I think it's always possible that people will be using tobacco products due to stress. I think the idea of a planned phase out of sale that takes place over a period of time, building in with cessation and support resources, is about saying, look, this is happening and you have time to prepare for it. So I don't think anybody can say, yes, there'll magically be way more mental health resources suddenly, but certainly if we're spending less on tobacco-related diseases and other tobacco-related problems, we may free up some money for other kinds of stress relief mechanisms. And as nicely pointed out here, quitting smoking has been shown to reduce stress. So I think there are a lot of ways to think about this. It's not just about having nicotine to reduce stress. It's also about other kinds of things. Is there a plan to increase support for cessation services to Californians that want to quit in the end game plan? And yes, that is a big part of it. And in fact, I believe there's a new launch of the California Quit Line with a new focus and some more languages and resources as part of that. It's been a very effective program. But the one thing that I think is really important to understand too is that in California, people have quit faster at greater rates. The California program has never had a major focus on cessation. We've just had the Quit Line pretty much as part of the statewide funded program. And yet Californians have quit faster and in greater numbers than in other states. And I think that's because quitting is not just about individual behavior. Quitting is about shaping a social environment that really makes you want to quit tobacco, that makes quitting tobacco just be what people are doing. So yes, there is a plan for greater energy for cessation services as well. But I would just say that we can't just think about cessation in terms of nicotine replacement therapy or formal programs for individuals. We have to think about how does the environment make it easier for people to quit. If you're trying to quit and it's still available on every street corner right in front of you, that's not how, that doesn't help make it easier for you to do that. So I saw another comment, but it left me quickly.
There's a question about how the end game is different from alcohol prohibition.
Oh, I knew somebody was going to ask that question. Now, I wish I could get it up so I could see it better because I've got, okay, there we go. Is that in the Q&A or the chat?
The chat, that's in the chat.
Okay. Yeah, I actually have, you're referring to something that I wrote, but I actually think there's a better piece that I'm currently just working on with Robert Proctor, a historian at Stanford. And basically the argument is, and we've had a lot of discussion of this on our team, the industry has really worked to further this idea that ending sales of cigarettes in particular, and really any tobacco control policy that would be effective, is prohibition or tantamount to prohibition or prohibition in disguise or prohibition something. And they have systematically worked to shape this analogy for decades so that we just automatically go to thinking prohibition. But in fact, the better analogy is abolition, as in abolition of slavery, abolition of dependency, abolition of oppression, because these are not products that provide you with freedom. These are products that enslave you and addict you. So I think we're working on a piece that hopefully will have some helpful ideas for how to respond to those prohibition arguments. And I know we're getting close to being out of time. So are there urgent things that we haven't discussed? Oh, and thanks to Monty for pointing out that, did you point this out? I can't remember, that code enforcement for in Beverly Hills and Manhattan Beach, city government, e.g. code enforcement, is responsible for enforcement. So they will have a mechanism for complaints from the public, but it's not a police thing of them going around to stores or getting people off the streets because they're smoking. And in fact, this is really something that's emphasized in California's endgame planning, is that it is not about purchase, use, and possession. It is about retail sales of a product that harms when used as intended. So it is a consumer safety measure. It's not about somebody having some in their backyard or somebody smokes a cigarette. Yeah. So I think we're almost out of time. I would really like to thank you all for making the time to attend. And there was a question about making the slides available, Libby and Patricia. We can probably do that, I would imagine.
Yeah, I think the easiest thing would be if someone wants the slides, they should email me and I'll send them a copy. So,
and as I think I posted, the white paper itself is also available on the ASH website on my California page. And we are really thrilled that so many of you from California took part, and we are happy to answer any questions if you'll email us directly. My email is ruth.malone, MALONE @ucsf.edu. And I believe that Libby and Patricia are typing in their email addresses as well. And we'll be thrilled to hear from you and talk to you about your endgame planning. So it's part of a big conversation that's going on all over the world. So it's an exciting time, especially to be working in California, but really everywhere. So please do fill out the evaluation. It'll be a huge help to us. Last thoughts?
I just wanted to mention that Carol from ASH mentioned that the ASH website would also host the slides. So you don't need to email me to ask for a copy. You can just download it yourself, which is great. Thank you, Carol.
All right. Thank you so much, everyone, for making the time to attend. And what is the ASH website? If you
Action on Smoking and Health.
Yeah, Action on Smoking and Health US, and they have a California page. Yeah. Thanks so much, everybody.
Thank you.
Okay.
Bye.
Bye.